Hello, everyone, and thanks to those of you who are able to stay on in lieu of the typical regional call that would happen after today's webinar. As Kinkini said, I will be sharing some updates from USBC. We have a lot to talk about, really in three major buckets. The first is that I will be sharing some top 10 new USBC support resources for coalitions. We had actually first envisioned sending you such a top 10 list maybe as a countdown to the new year, but didn't want it to get lost in all of the holiday shuffle. So we decided to hold off, and we're excited to share with you really what we thought of as the top 10 new things. There were so many new infrastructure supports that we launched in 2015, so we'll be sharing that. Secondly, I will be sharing an update about some proposed bylaws amendments in the USBC world and how those will impact the coalition's engagement in USBC. And then thirdly, I'll be talking about the actual detail of the design of a coalition indicator for the CDC breastfeeding report card. We know we have alluded to this on past webinars. We've talked about that we've been working on it with CDC. And today we actually will be showing you what that is made up of, at least as much as we can in this 1 hour slot. So. Again, if you need to leave or if you need to leave partway through, don't stress. We will record the whole thing, and you could always click the link and look it up on YouTube and even fast forward to where you had to sign off. So I'll jump right in and get started first with that top 10, the new supports for coalitions that we have launched in 2015. And they're going to start off a little bit more general and then get more and more specific to coalitions. But really, starting off with number 10 is the individual website profile. Most of you probably know that we launched a new website in the spring of 2015. And the individual profile really is the entry point to many, many things in this new world of the site. So if you haven't yet gotten a user account, I do encourage you to do that. It just takes a couple of seconds. You can see here you enter your email and your first and last name, and that's it. But then you do then have a profile where you have the option to add additional components, such as more contact information, information about your coalition affiliation or affiliations, plural. Some of you might have a state and a local that you're part of. There's a space for a brief bio, areas of expertise that you can select from, and you'll see where that goes, why that's important in a little bit, and then also demographics. We are tracking demographics in this site for the first time, especially as part of our recommendations from our CRASH committee, our Diversity and Equity Committee.
We heard through the grapevine that
then also with the individual profiles, there is a public version, a public side of that is called your My Page. And you can see here, this is a screenshot of what mine looks like. You can actually set visibility preferences for every single bit of data that appears here. And you can see that in my profile, if you can see this small, where some of them have little asterisks next to them, that means that I have set that field to not be visible to anybody else. So that's why that appears. But again, you can see this is a nice way to connect or meet other folks within the site, whether in your coalition or beyond, and to share just as much information about yourself as you feel comfortable with. And then again, there are connections and followers, and really the easiest way to think about that is that connections is like Facebook, where you choose to connect to somebody else and to be able to see their page and their information, their profile at a deeper level. And then followers is more like Twitter. If you're a Twitter user, where you can see somebody's feed of their activity within the site. If they made a post or loaded a file, you'd be able to see that sort of activity feed for your followers. So never fear, we're also getting ready to launch some new profile orientation videos. Many of you who are coalition leaders saw the long version of the website orientation that we started off with last spring, but we're going to have a whole slew of new tidbit videos that are just about the specific piece that you might want to know right now. So second piece, number 9, is the group profiles in the website. And these include your organization, your coalition's information, membership demographics about your coalition. Again, it's one of our equity priorities, as well as these 2 new things that we started to talk about and to include in our website this past year. One of them is the engagement levels, and these, there's 4 different levels that define your organization, your coalition's level of interest in all the different topic areas of the call to action, plus some more. And then also activity descriptions, and these populate into a public action directory that is framed around the Surgeon General's call to action. So you can see on the next screen, this action directory has, of course, 20 public pages. There's one for each of the actions. And on each page, I'll show you actually on this next screenshot, this is as a sample of the Action 7 page, and it starts off with listing the implementation strategies, USBC resources, and then down below it will have actually national and state and community activities. So we can actually click over and see, as we scroll down, we will see the national activities for different USBC organizations, whether they're our members or our partners. If they are a member organization, they'll have this little symbol, and that's how we can tell they're a member. And then there's also a whole section of state and community activities. So here we can see Connecticut. They've loaded a bunch of information and their logo, Florida, Kansas, Minnesota, and so on. So if you haven't yet started to use this, we really hope you will in the early part of this year. Go in and load up your profile with that information into the action directory. It's a great way to promote yourself and connect to others that are active in the same areas. Number 8, another general website piece, but especially useful for coalitions, is the online learning communities. The new site has also 20+ online learning communities on all the different topic areas and more. These are, they're open communities, so any site user, anybody who has requested that quick login can go and explore these and join the topic areas that interest you. And you then have also the option to subscribe. When you subscribe to something, that means you will start to receive email from it, or you can say, I only ever want to look at this in the website. And this link here will take you to the whole list of all of the communities. And then this one is an example of what that looks like. It's some of the different components. This is the formula marketing one. And again, you can see that it talks about Surgeon General's call to action, that framework, the implementation strategy at the top. And then there's different tools within it. So there's a news forum. This one is where we at USBC are regularly posting different news tidbits that we come across in all of our triaging that we do for the weekly Wednesday Wire. We actually have way more news that crosses our desks than we can even put into the weekly Wire. So all of that news, whether it makes the bar for weekly Wire or not, does get coded into the learning community. So if you're interested in particular topics, you can also drill down and get those news blurbs here. There's also forums for action opportunities. If there's something happening, a new campaign, a new law, something that you'd like to share with other folks who might want to take action in this area, you can post there. Collaborative ideas, another opportunity to connect up with others. Maybe there's a funding opportunity that you see and you want to see if others are interested, as well as just general networking and sharing. There's a file library as well for just general sharing of materials or information, articles about the topic. So that's the topic area learning communities. There's also, of course, the Coalition's Learning Connection, which is the new Coalitions Forum area that houses all of our past sessions of webinars, conferences, libraries, and discussion forums for you all to share amongst yourselves. And I know we've had some activity starting up there anew. There's also our targeted listservs and sharing communities for folks in different coalition leader roles. That's a piece we're getting ready to really launch in 2016. And then again, anybody connected to a coalition at any level, any type of coalition leader or member is welcome here. And this link here, coalitions-connect, is how you get to the learning connection. Number 7, so the Coalition's Learning Connection is the general online space for all coalitions to come to meet. You also have the opportunity in the new website to have an individual workspace for your coalition only. And I know many of you have taken advantage of this and worked with Danae in the past several months to have an initial orientation and training of your administrators for these. And these are, just very briefly for those who haven't yet done that, these are private sharing spaces that you can use either for your coalition membership, your coalition leadership, or both. You could also have one of each type. And they can house all sorts of internal collaboration, communication to and between your different member groups or subgroups, committees, task forces, what have you. File archiving and sharing if you need a place to post all your minutes or your in-progress brochure files or whatever it is that your coalition is working on, you can store it there for sharing. There's blog possibilities, there's a roster, calendar, all sorts of tools that you can choose whether you'd like to use them. You don't have to. And then you can also customize them to your needs, whether for your membership, your board or leadership team, or both of those groups. Local coalitions can also request to have their own separate local tools, a forum and a file library within their state's community. So that's also an option if you have locals in your state and you'd like to be able to house them or host them. That's another possibility. Here you can see I've taken Texas as a guinea pig example here. They've posted some information in here, their meeting materials, minutes, rosters and things. They've started to use their announcement list. They sent out a year in review message at the end of 2015. They've got their image of their coalition up here. You can put whatever image that you'd like up there. And they also have a projects in progress that they're working on. So this is an example of sort of the default of what we put up initially. But again, you can change and customize any of these types of tools to be whatever kind of file library or forum you would like. And you can see on the right side they have their calendar, they have some quick links, and so on. So lots of great opportunity there. Number 6 is what we've called, for lack of a better term, complementary infrastructure support. And what we mean by that, there are several different kinds of benefits that we have access to at USBC that in the past couple of years we've been able to also extend to you in the state coalition. So these first two here, Board Source and the Nonprofit Risk Management Center, these are both memberships that USBC has where we were able to have an affiliate structure to give all of the state coalitions access to the membership benefits as well. So Board Source really is focused around nonprofit governance and boards, and they have a wealth of information, both consultation that you can access by email, webinars, publications, books, all sorts of things that you can access through their website. And then the Risk Management Center is similar, but focused even more down on specific risk management topics. So those of you that have questions about insurance, what kind of insurance do we need, who does it need to cover, how much does it need to be, they're really a go-to place for that. And again, they have experts on hand who can talk with you. They have webinars live and archived. And they also have a really cool an inexpensive risk management plan that you can do with their web tool. So highly recommend them. I know some of you got to experience their webinar training last year as well. And then there's also two others that are not memberships per se, but both our USBC legal firm, Venable, and our new audit firm, which is called Orba, have these free seminars, free webinars that they offer. And they really have, especially the Venable ones, I see a wealth of topics go by that are of interest to us and I believe to you in the coalition. So I really highly encourage you to look at these. Again, these are links that are embedded here. All of this information of how to access the member benefits is also posted right on the top of the coalition's Learning Connection. So if you haven't seen it yet, do check it out there. And you can find, all sorts of things of great webinars, and they're all archived and recorded so that you don't have to worry about whether you can attend on that day. Number 5, speaking of webinars, USBC, of course, has had our 2 coalition-focused webinar series for the past several years, this one and also our Power Tools. But this past fall, we ramped it up, and now we actually have 4. So, again, you see the first 2, the CDC-USBC jointly hosted 222 series, is what we call that, on the 2nd Tuesday of even-numbered months. Our Power Tools, which is really focused on capacity building type of resources, and that's where we do things like the risk management training or grant writing trainings, that sort of thing. And then we have 2 that are definitely of interest to coalitions, but are also open to the whole of the breastfeeding field, and those are our racial equity and collective impact webinar series. Both of these, as you'll see here, have associated online learning communities that are connected to them, and these are a little bit different than the topic area learning communities I mentioned a little bit ago, so I'm going to actually show you a bit more using the racial equity one as an example of what we have in these. These are really a little bit more robust in terms of the support that we're able to provide to these through different funding sources, where they each have a bi-monthly theme where we would start off presenting that theme in a webinar or some type of a web meeting. We might use different formats for that. They each have file libraries where we can share selected general readings, recommended ones, and sometimes we'll do them at different levels, like beginner, intermediate, advanced, depending on if you're just starting out in the topic area. And we can also post readings related to that month's theme. And then there's a forum for discussion and questions and sharing among the community participants, as well as blog posts. And we have had a variety of both guest blog posts, some that were written by us, some that were folks totally new to the USBC network who have come in and been gracious enough to share their experiences and their stories in blog posts. So a little bit of a different format to the topic area ones that I showed you earlier. All right, so we're down to number 4, which is actually a pretty big one, advocacy supports. We probably cheated a little bit and put a bunch of things together in one number. But advocacy, of course, is the key part of all of our work and activities. You can see here some of the images and the different memes and Twitter tools and things that we've done over the past year on different topic areas. So first of all, we have revamped and relaunched, and we're also looking at another tool to continue to expand the Breastfeeding Advocacy HQ. You can see that it now includes links to our active action tools as well as several partners. We've got some other aligned issues where USBC may not be the leader in that action, but we are posting some of our other national partners links as well. So that includes paid family leave and paid sick days, pregnant workers accommodations, childcare, and so on. So we encourage you to check those out and to share all of those different links and actions. And there's also a toolbox. I know we can't show everything on the screen here, but all of our resources for breastfeeding advocacy, tips for having meetings, about lobbying rules, and even down below it is now a central place for handouts that you might take to visits and so on. In addition to that, we've launched a couple of new things this year. One of them is an open legislative and policy learning community, and that one, again, is part of the 20+ learning communities, so we do post regular news in there and the like. We also have expanded and merged into the website our databases of advocacy contacts. So we'd had many different folks that we connected with in different organizations, and now they all exist in one place, one database, and we've begun to host periodic networking calls, both for our national partners and members and for state coalitions. So I know we've had a couple of these, and you may have been on them or have heard about them from your coalition leadership. We are looking to experiment in 2016, both with having those national and state networking calls separately, which is how we launched them in 2015. They happened on separate days, versus having them together. And we do think we'll have a shared one, a joint one, in the summer in the lead up to National Breastfeeding Month, where we all are on together with both the national and state contacts, preparing our different campaigns and actions for August. So we're looking forward to that. And then each of these advocacy contact groups, the national and the state, has their own private community for sharing, whether it's the recordings or information, handouts from our networking calls, or other information that folks want to post about their own actions or activities. Those tools are available, and they also cross-pollinate so that the national folks have access to the state coalition's postings and vice versa, so that you're not isolated, away from each other's information. So do recommend to continue to participate in those. We're excited about ramping those up as a new tool to better coordinate amongst all of us from the grassroots to the treetops in our breastfeeding advocacy work. And then, as I mentioned, those individual profiles, that's where you tell us if you are particularly expert in specific content or topic areas. And, these might seem like they're just a part of your individual profile, but this is where we, as an example of where we might look for that. Let's say there is a hearing happening in Delaware about a particular breastfeeding bill, and they're looking for somebody who could speak about a certain topic or provide testimony. This is a place where we can look for that sort of information from your profile. So just one example, I'm going to have another one in just a moment. So another resource that we have built in for advocacy. And then specific to the state coalitions, we also have now made our action campaign software available to any state coalition that has a bill pending. The tool can target state legislators in just the same way that it does with Congress, where it will ask your supporters for their address and their zip code in order to figure out who are their state legislators. And then blast them with emails according to the template or the talking points that you give them. We can also, if you have an action for the state of Delaware, for example, we can also send that action to the folks from that state that are on USBC's action alert list. And since we have more than 20,000 people in our list, we think this actually could be a great way to better expand your list of supporters and get them excited about what's going on with your state's legislation. So do check in with us about that if and when you have pending bills. We also have, for many topics, because we've either done bills about them in the past or we have information compiled from previous state campaigns, we are likely to have some talking points or text that you could even build on from prior action alerts. So might be a quick and easy way to do that. We also are working on an updated catalog of all the different state laws. I know many of you have been working with Cheryl Lebetovich on the workplace side of this, but we're also working on the other types of laws, and excited to see that there's even new types of state laws happening around the country. And then, of course, the state law inventory and analysis that Cheryl is doing for workplace. We're also looking to do that analysis for other types of bill language, other types of laws. I have actually brought on an advocacy intern this winter who is helping to really expand our capacity in some of these areas. And then lastly, these bits could apply to advocacy, to media, to many places, but I chose to put them here specific to content for your campaigns or action alerts. Of course, the photo projects, the photo galleries are now up and available free to folks who are working on breastfeeding promotion and support, at this link here. And then, of course, our story collectors are a similar resource with words instead of pictures. So if you're looking to do an action alert and you want to have a quote from a mom, you could check out the support stories, and those are available also as a resource for you in addition to USBC and our members. All right, that was a big one. Down to number 3, communications and media supports. Similar to the previous one, of course, we have all of our typical communications, many of which you probably are already aware of, the Weekly Wire, of course, and our social media presence. This second one, though, might be more unfamiliar to folks. It was a new piece that we launched in mid-2015, and it's called the Breastfeeding in the News blog. And it's not so much a blog in the typical sense of that word. It is using a blog tool to aggregate just little snippets, news clippings of all of the mentions of breastfeeding that we see in traditional and online news media. So it's going to be breastfeeding specific. You're not going to see us posting, you know, if it was an article about paid leave that didn't mention breastfeeding, that wouldn't make it here. It's going to be specific mentions of breastfeeding. But one thing to know about it is that we're also not going to make judgment calls here about how good the coverage was. We are using this particular aggregator tool as a place for us all to see in a quick snapshot, what is the media saying? And so that might mean that you see articles there that aren't so great. We might not all love them, but we're doing that because we want to make sure that we all are able to see that broad snapshot of what the media is saying, you know, whether they were on our talking points, on our message or not. So I encourage you to check that out as well. And then on the media side, just like with the advocacy, we also have a media learning community that is in the open section of the learning communities, similar databases and networking calls. We just had our very first one of these networking calls just in the late fall. And for that first one, we did have a joint one of national and state contacts on the call together. Because that was our very, very first one, we don't have quite as many folks on our list yet, so we're looking to build that list up and to have our next call in the spring. That group on the very first call, though, did have a robust discussion of what sorts of things that they might be able to do and share and network about, including triaging of media inquiries. That's another way that we're able to use the wonderful group profiles is to know who's active in which areas, and we might be able to send media inquiries to specific organizations that way. And then we're also creating a talking points aggregator. So just as I said, the media mentions, the breastfeeding in the news is aggregating all mentions of breastfeeding in the media, good or bad. We're also creating a tool that will aggregate all of our talking points, our good talking points about different topics in breastfeeding so that we don't have to each be reinventing the wheel every time we get a question from a newspaper or journalist or so on. So looking forward to launching that, and we have several of our national partners who were also very eager to share their talking points with us and with all of you. And then, of course, again, the content topic experts, where that's in your individual profile, we might also be able to draw upon that to look for experts for media inquiries. And then, of course, the last media bit, which could just as easily transfer over to advocacy as well, as our National Breastfeeding Month campaign, where we typically do have a partly social media and partly advocacy-focused theme that we implement. So we're looking forward to that. Any ideas that you have, we're in the brainstorm phase for 2016, so please send them on over if you have any bright ideas or themes or slogans. We're in that early phase, so your thoughts and feedback are very welcome. Two more bits here, getting even more coalition focused. So number 2 is what we call the MEC, or the Matrix of Effective Coalitions, and the associated library. And I'm not going to spend a whole ton of time on this because there's an entire other webinar that Kinkini fabulously presented in August about the needs assessment and the MEC resource that came out of it. And you can see here just some of the smattering of very, very high level. What we learned out of the needs assessment is that the coalitions have many, many needs, and really, across the board, across a variety of different capacity areas. And what we did is we created this matrix with specific markers of effective coalitions across a growth continuum. And you can see the 4 different stages of growth and the 7 different categories here. These are going to come back also in a bit when I talk about the report card indicator. And the matrix itself looks like this, where there's a description for each indicator. There's a row, and then a description of what that indicator would look like for a startup coalition, a young coalition, a developed, or a seasoned. The really exciting part we are now ready to launch officially in the website is the resource that goes behind this. So this is now a self-assessment tool that a coalition can take and can look, where does my coalition fall on these governance and leadership indicators, for example. But then now you can go into the website, and there is a learning community file library for each one of those 7 areas. And so here you can see the communications one, the impact, funding and sustainability. There's an entire library for each of these, and it actually only displays 10 resources on the landing page screen that you see here, but there's many more in each of these areas. And they're going to have this ** USBC as an indicator to you that this is a USBC recommended resource. But anybody can also post additional resources or examples from your coalition into the forum, so that we made all of our recommended ones have the USBC at the front so that you could easily search those out, but then you'll also be able to share and see each other's resources. And then the really cool part, the part that has been a bit of a delay for us, is this word cloud and tagging resource. So as I showed you on the first slide, the matrix has a row for each one of these different indicators. And so you can see here we're looking at F2. So F is funding and sustainability, and indicator number 2. The website has a word cloud and a keyword tagging system where we've also been able to tag each one of the resources that we post with an F2 or a G3 if it was governance, or whatever the different code was for that section. So if you identify my coalition, it needs to really work on meetings and operations, indicator number 9 this year, you'll be able to go into the site and click on M-9 and find only those resources that we have identified as relevant to that area that you want to improve upon. So this is just a quick screenshot of what that looks like for one of those tags, and then you can see the detail about one of the particular resources and where we put in, who is it from, a little bit about it, and then you can download the actual file or files. So that is a long overdue and very exciting launch. Now I'm down to the last bit, which is, of course, the National Coalitions Conference. You can see here a new theme for 2016 is a new day, community engagement for equity in the first food movement, and how fabulous that we were able to start off our this webinar series today with hearing from Rose about CHAMPS and the community transformer work that they're doing. So just very briefly, the call for proposals is very, very nearly ready. It will be going out with the typical submission options for breakout panel presentations, posters, or breakfast table topics. So we hope all 50 coalitions in the states and territories and tribes and local communities and cultural coalitions and beyond, we really hope that everybody will post, propose a presentation in one or more of these different types this year. We really have expanded the coalition beyond expanded the conference beyond just a focus on state coalitions. So please do share and spread this around to all of the coalitions in your state. The schedule is a little bit different this year, though. You can see we're going to have the pre-conference workshops to be on Friday this time. In the past, they were on Saturday. But then we'll have the opening session on Friday evening. So if you were coming in just for that opening and not for the workshop, you would probably travel on Friday. If you were coming in for the pre-con workshops, you would probably travel on Thursday. Then the main conference itself will be Saturday and Sunday. So it will be a bit of an extended conference. Will actually end at 3 o'clock on Sunday. So some folks might choose to go home Sunday afternoon, Sunday evening. But then the advocacy day will actually be also extended and will be on Monday. So that way, instead of having it all smushed into one afternoon, we'll be able to get together early Monday morning and have the full day, including across the lunch period, to be on the Hill, which will also really help out with scheduling appointments. We have a little bit more time and opportunity to offer. And then we'll still, of course, shuttle people back to the airports if they were going to leave in a mid-afternoon flight again on Monday. So again, we're looking at having at least 2 subsidized attendees per state, but you'll see in the next section there's lots of different factors in play that will come into the talk about August and the meetings and the conferences. So this is just the outline of the schedule for now. And that piece that I want to talk to you about is the proposed new membership categories. And the background here is that our CRASH committee, that's the name for USBC's Diversity and Equity Focused Committee, made recommendations in a number of areas that were adopted actually not last fall, but in the fall of 2014. And they included these specifically to membership, among others, but specifically about assessing and addressing barriers to participation in USBC membership, outreach to non-healthcare sector and non-national organizations, as well as participation through other means aside from just being in person. So that could be conference calls, webinars, and the like. So last summer, the membership transformation team conducted a thorough review of all of our bylaws membership categories. And there was several meetings, a lot of deep discussion about the recommendations and what did they mean for us, how did our current system really impact accessibility for folks across the spectrum of breastfeeding advocacy, really from the grassroots to the treetops. And also, what did we really need to have the maximum impact as a coalition, as a national coalition for breastfeeding? So there was a lot of discussion, some additional input from our board of directors, of course, and then we put forward a proposal to the membership at the meeting in August. And just by way of a bit of perspective, the coalition categories that I'm about to show you, I don't have time to go through the whole proposal, but the coalition categories are just one piece of a broader proposal with revisions to some of our existing categories as well as new member categories. And then the membership category changes themselves are also just one piece of a much larger bylaws amendment proposal. So it's been 5 or 6 years since we had a full bylaws review, and there are a number of areas that we'll be proposing other tweaks, other updates to the bylaws as well. So I'm going to focus in just on the coalition categories for today. First of all, the state territorial, and this is really very similar to the status quo where we have, one registered coalition for each U.S. state and territory. Those of you who are existing in that category will just automatically become a USBC member. There's not going to be any need to do anything special or to apply or renew in the future. You will just be sort of grandfathered in. So fabulous news, no action required for this part. For those who might be new coalitions, and I would expect this would be primarily for if there's territories that don't have a coalition in one forms in the future, there will be a registration process, of course. But for those that already exist, you will just come right on in. For tribal coalitions or tribal entities, the current proposal is worded as you see here, that any federally recognized tribe could apply. Of course, we do ask that they be supportive of the mission of the USBC, but that's that's just because the tribal entities might not be specific to breastfeeding. It might be that the tribe itself is becoming the member, as opposed to in the state, it's not the state government becoming the member, it's the state breastfeeding coalition. So it's really a given for you all in the states that you are interested in breastfeeding. Similarly then, for local communities, any breastfeeding coalition that is serving a city, town, county, metro area, or intrastate region of the United States would qualify there. Again, you'd be telling us that you are a breastfeeding focused entity, so and therefore you're supportive of the mission of USBC. And then also a category for cultural, any breastfeeding coalition that is serving a specific racial, ethnic, or cultural group. Again, it has to be within the U.S. because we are the U.S. Breastfeeding Committee, and then here at a subnational level. And the reason for that subnational bid is described in the note, that if there is a nationally focused, whether it's an intertribal, I know there's activity there, or if it's a national breastfeeding group that is serving a specific racial, ethnic, or cultural group, then we would actually want that entity to apply under the category of national nonprofit. So it's just really to distinguish the area that the organization is serving. So, these are just the coalition categories. There also will be other new categories that will open up USBC membership to other types of non-national organizations, just ones that are not necessarily breastfeeding coalition in nature. So a bit more about what this means, the coalition category details. All of them will be voting memberships. But just to be clear, it's actually the organization, it's the coalition that is the member, and then that coalition appoints individual representatives to exercise its rights to vote and to participate in USBC activities. The members of USBC formally vote in two ways. They elect the board, and also they vote on revisions to our governing documents. But another less formal way that members interact is to provide non-binding feedback or comments on position statements of USBC. So that's one example. Of course, there's other types of feedback procedures that we have at USBC that coalitions have been part of in the past, even though you've not been members. That's one of the most common ones, is position statements. And then another key governance bit is that the individual representatives of all of those coalition category types, the state, territorial, tribal, local, and cultural, all of their reps will be eligible to run for the USBC board. So that will be a major change in the pool of folks who are eligible to run for USBC's board of directors. So something to think about. And when folks are on the USBC board, I think it's also helpful to remember that on the board you serve as individuals, not the organization representative or the coalition representative. When you're functioning in the membership as part of the membership body, you would be serving as a representative of your coalition. But if you were elected to the board, additionally, on the board you would serve as an individual. The process will be pretty simple and direct, we believe. There'd just be an open application, a brief online form to fill out. Of course, the exception here is the state and territorial coalitions that are already registered. As I said, you're just going to be grandfathered in, not any special thing to do. We don't anticipate any dues or fees for the coalitions, of course. That would be sort of contrary to our purpose in trying to expand your capacity as breastfeeding coalitions. But we do have this set of coalition principles, which many of you may not recall, but when you first registered to participate in USBC as a registered coalition years ago, we did have everybody sign on to a brief set of principles about things like adherence to the code, and that you would function ethically and, be open and inclusive, that sort of thing. So we do expect to have those principles continue to be a part of our functioning, just as we do with our members. meetings of the membership will also be very, very different, of course, with this new proposal once it takes effect. Right now, we have had membership meetings of USBC in January and August every year in the DC area for more than a decade. But we do expect that will be shifting, and of course we don't anticipate that coalition members are all going to be able to attend every single meeting in person. And for that reason, we do plan to webcast the general session parts of meetings starting in August, as well as actually for this past meeting that just occurred, or really didn't occur because of the snowstorm a couple of weeks ago. We're also looking into how to map together the conference travel support, the National Breastfeeding Coalition's conference that does provide travel support for 2 representatives per state. We also have a tribal scholarship that is offered for the conference, and how that could also be extended to allow attendance at the meeting that is held in conjunction with, just before the conference. So we're looking at how to best connect those parts together. And we're also looking to continue to have Constellation updates overview as a web meeting following each USBC meeting. So for example, in September, we had a special webinar session where we presented to you in the coalitions about what had happened at the August meeting with all the different Constellation topics. Those are our work teams, our work groups on different topic areas. So we would plan to continue that sort of web connection. And let's see, just a quick note here that we haven't done that yet, that special Constellation update for January, because there was no January meeting. The big snowstorm on the East Coast caused us to have to cancel a USBC membership meeting for the first time in history. And so we are actually just preparing to do a webcast version of the different general session portions of that. So we will, again, share those with the coalitions as well as with the members. So you will hear more about that. It's just not on the typical time frame. So you may be thinking, what about the regions? We've had this current situation of the 7 geographic regions, as well as the tribal region, that have been automatic voting members of USBC for several years now, and have elected 2 representatives per region and had travel support to attend meetings and so on. And part of the reason, a major part of the reason for that structure was to be able to have the coalitions have a voice and a stronger connection to the USBC at the national table. So now that we will be having all of the coalitions able to have a direct connection into USBC membership, that really put a different light on the concept of the geographic regions. And so what has been proposed by the transformation team, although this would not need to be a bylaws change, but it is a proposal that is actively under consideration to create a cultural alliance type of a group. We do expect to eliminate the geographic regions in the bylaws, but we wouldn't necessarily need to add the cultural alliance as a bylaws category because the cultural coalitions themselves will be the members. So they will already be in there. But the concept of the cultural alliance could be a way to take a slightly different take on having a stronger voice for the cultural coalitions within the USBC system. And so what that could be is, let's say that there are African American breastfeeding coalitions in, maybe they're in 15 different states, and they come in as cultural coalition members of USBC, and they would like to come together and form the cultural alliance. They could function very similarly to the way that the geographic regions used to, where they elect representatives who could then receive that travel support. That funding, as of right now, has not been assigned to anything else, so it is available if, assuming that this proposal is of interest and accepted and goes forward, the support funds that right now have been going to the geographic reps could transition and go to cultural reps. So that is, again, an active proposal that the transformation team has put forth, and we'll be looking ahead to how to connect that into all the different systems and meetings coming forward. So you're probably wondering, what is the timeline for this? And I only have about 10 minutes left, so I'm going to speed it up a little bit. But just quickly, right now, the bylaws revisions are undergoing legal review. We may have one additional Q&A or web session or something, again, because it is the bylaws amendments are quite a lot more broad than just this little bit that I have shared today. They're really spanning across most of the sections of the USBC bylaws. So we do need to make sure that everyone really understands and is fully on board before we go out with the ballots for such a complex set of bylaws changes. Then we do have the actual ballot mailing, or the ballot election happens by snail mail and must be adopted by a 2/3 majority of all of the existing voting members of USBC. So I've put in an approximate timeline for what that might take. Once we would have received back a 2/3 majority of votes adopting it, the changes would then take effect, as of that date. And we would then move forward to implement what we would need to do to really bring in and orient the coalitions as new members. So again, the states would just automatically be members, as well as any existing registered territorial coalitions, and then all other types of coalitions could then apply. And as part of that application process, they would designate their member reps, and we would very shortly begin holding some sort of webinar orientations for coalitions who were coming in. So looking for that as a summer activity, and you'll be hearing a lot more from us. We just wanted to at least give you the outlines of what is coming down the pike. Again, of course, this is all right now in the proposed bylaws revision status. But we have discussed it, of course, with the full membership at the August meeting and a town hall meeting session, and had very, very broad support for this concept. Everybody really has seemed to be very supportive, and we're really excited about the possibility of having the coalitions come in as full-on voting members with all of those rights and responsibilities and duties that you would have in that type of role. So looking forward to that. So lastly, I want to share a little bit of a deeper dive into what in the heck do we mean by this coalition indicator. Really, it should be called an indicator rather than a measure on the CDC report card. And some of you might remember that in the past, back in the 2007 to 2010 period, there was an indicator about the presence of an active state breastfeeding coalition on the report cards in those years. That was really measured just by the presence of a website. Did you have a website that we knew about? And we've been tracking those, of course, in our coalitions directory for several years. But it was a little bit rough, wasn't as deep of an indicator, and so we had talked with CDC for several years about the possibility of doing something that would be a deeper indicator of really the state of each state's coalition. So during those years, you can see there was no indicator on the report card, and we're pleased to be able to share with you what we've come up with for a possible design of a coalition indicator for future report cards. So this design that I'm going to show you is based on the 2013 Needs Assessment Survey leader version questions, which is why that actual survey is linked under here. So when you are looking at these slides, you'll be able to click on that and actually read the different questions that are referenced. And really, we have, of course, multiple goals with doing this indicator. First of all, just to better be able to communicate and share and understand the state of the state coalitions, both as a whole and individually, but most importantly for us to serve as an advocacy tool for you so that we can better initiate, enhance, and sustain support for all of you in the breastfeeding coalitions, whether that's funding or non-monetary kinds of support. Being able to have this as part of the report card will really elevate its importance and significance, and we're very excited about those possibilities. So what in the heck is it made up of? So it's based on priority questions that we sat with CDC and pulled out from each of the 7 areas, and you can see these again are the 7 areas of the MEC, the Matrix of Effective Coalitions, and you're going to see them again here. And then for each of those priority questions, we had a system to apply numerical values to the range of possible responses. So if you are familiar at all with the MPINK survey scoring, it is somewhat similar to that. And then each one of those questions would translate into a scale of 1 to 100, so that there was a way to make that happen for each of the different priority questions that we picked. So I'm going to show you, and again, you'll have the slides for all of these, and you can take these little Q37, Q28, and look at question 37 or question 28 on the original survey to see what the question was. But these are the priority ones for governance and leadership, governance documents, demographics of the leadership and how that compares to the state's population. Purposeful and productive board meetings, that's measuring the number of times that agendas and minutes were sent compared to the number of meetings that were held, and of course your own statistics on your attendance at your leadership meetings. I have an example of some of the different ones. So here's question 37, the one about the governing documents, and you can see on the left side here the different governing documents that we asked you about, your vision, mission, bylaws, policies, roles, nominations process, and so on. And you would tell us the extent to which you had these. So over on the left, I've put the key where we said if the answer was not sure, that would get a 0, little to no would be 33, moderate 66, large extent 100, so that there was a way to have a numerical, I know it seems rough, but a numerical value assigned to each of those answers for each of those each type of governing document. And then each one would get a score, and then all would be averaged. I've just made a note here, though, that these last 2 in this question 37 about conflict resolution and code of conduct are not part of this governance section. They're part of an indicator in the culture section. So we'll see that in a couple of slides. On the membership, it includes the question about having local community coalitions, the diversity of individuals, sectoral diversity, so that's what you see here in the image of question 35, and also types of membership. That question was about whether you had individual members, organizational members, or just individuals on an email list, sort of general supporters, or the combinations thereof. And you can see my example here for question 35. On question 35, it's only this 4th column that is the member of coalition. So for this particular one, we would only be looking at those checks where you said they were a member, and we would look at the percentage of the number of checks that you picked on all these different options, divided by the total possible. And then what CDC would propose there is to analyze the distribution overall of all the coalitions and their sectoral diversity and assign scores accordingly. So this wouldn't just be a straight, if you had 0 to 5, you would get a B or a C. It wouldn't be that way. It would be comparing you all with each other. So several of them had that sort of a procedure where there would be an analysis of the distribution of all the coalitions. This slide is really just the rest of the different sectors in question 35. So the whole list is shown here. On culture, here's where those conflict resolution practices come in, as well as member engagement. And again, I've listed the key, so you can see how different answers get a 25, a 50, a 75, 100. Everything gets averaged. So again, you can see a little bit of an example of each one to give you a feeling. For meetings and operations, there is a question about, do you have a paid staff person? And so some of them, like this one, are just yes or no. So that's one of the ones. Purposeful productive membership meetings is the same method that we did for the board meetings. Attendance, again, but for membership meetings. And then again, the number of ways that media are currently used for communications. And again, you can see the key for how the different responses to whether you use media as your website, Facebook, Twitter, a blog, an online survey, an e-newsletter, you would get different scores for the different answers, and they would be averaged. Communications, again, a similar type of thing, but it's all based on this one question 36, but with some of them were more internally focused and some of them were more externally focused. So that's the A, C, and D just refers to which row of 36 it's referring to as internal versus external. Impact, this question includes, there's a question about community engagement via a needs assessment. There's this question number 30, which looks at your level of activity or engagement across the 20 different Surgeon General's actions. That's the one that's screenshotted here. And then also engaging with a diverse spectrum of organizations across sectors. That's that same question we looked at a minute ago where we were just looking at column 4 for members, but here CDC would be looking at your answers for all of the options, whether they were a member or a non-member, any type of engagement whatsoever. And then the last section is funding and sustainability, and would include the number of funding sources as well as whether or not, just on a yes or no, the coalition had funding from the state government or from foundations. So again, so you can see the question number 5 here is the base for this one. So again, you'll have the slides here as well as the full survey to look at so that you can see which of the questions are part of the indicator. We do plan then as next steps to launch an abbreviated version of that leader update survey as soon as possible this week so that we can ensure that your data is up to date. We don't want to send your previous, couple years ago data for this. We want to make sure that you have a chance to tell us, just for those specific questions that I highlighted, the updated information. So it will be much shorter than the original needs assessment survey, just again including the questions from the indicator. And we will also reference the question number from the original survey just as to keep us all straight in terms of the calculation and this presentation and all of our different references back and forth. There will, again, just be one response per state coalition. So again, it will be a leader of your coalition that is asked to respond, and we'll be sending the invitation with a link just to your primary and your poll contact. So that's likely is just your coalition president or secretary type of person. And then tentatively, the plan is to add it to the 2016 report card. All of the components that are described, in the slides previously would be compiled into one composite indicator score. That there wouldn't be, 7 different new columns on the report card. There would just be one. But as you heard from Kelly at the end of last hour, the timing is a little bit up in the air right now about the NIS data, and so therefore about the report card. So I don't know exactly what to tell you at the moment, but we are, certainly waiting along with CDC to find out what the results of those negotiations and discussions will be about the NIS data, and then accordingly about the report card. Certainly, if it were to come out in August, we would want to take it to the Hill with us for Advocacy Day. If that doesn't happen, we will bring other materials for you for the lobby day. So I think that is it in terms of the many updates. Apologies for bombarding you with so many, but as we now need to go and record the general session of the canceled membership meeting for you, we wanted to at least get all of this coalition information out today. So please do look for that, though, the update from the membership meeting, and also additional updates as we go forward with the leader update survey and the membership categories and so on. Lots to communicate about and lots of new resources to continue to connect. So I don't know, Kikini, I think we're a couple minutes over, so might be best to take questions offline, and we could set up an FAQ or some such on the Learning Connection. Would that make sense?
Absolutely, and that's what we are. We'll be floating questions from both the webinar session as well as today's extra feature on the coalition.
Okay, you're a little hard to hear. Sounds great. Yeah. So if you do have questions, why don't we leave the webinar system on just for a little bit longer? If you'd like to type us a question, or you could also email to us at this address coalitions@usbreastfeeding.org is the best place to send any coalition-related questions. And we'll try to respond to those and perhaps also create an FAQ out of anything from all these updates. So thank you so much for your attention and for sharing all this news with your coalitions. We'll look forward to talking with you very soon.